If you've bitten on a hard object and now your tooth is aching, there's a high likely chance that it's cracked, and it's called as cracked tooth syndrome. Hi, my name is Dr. Rudra Mohan, and today through the Oral Health channel, we're going to be talking about cracked tooth syndrome. Let's start. So today we're going to be talking about cracked tooth syndrome, a phenomenon that happens when you usually bite over a hard object with the help of your teeth, or otherwise your teeth are actually broken down already because of dental caries or large restorations, thereby making the enamel and the tooth substance in your tooth and oral cavity a little weak and susceptible to fracture. So how does cracked tooth syndrome present? It basically presents as, first of all, pain, which is usually either seen with the help of biting the teeth together, or especially when you bite the teeth together and then as soon as you release the pressure, then it is considered as a pathognomonic sign of cracked tooth syndrome. Other symptoms include, cold sensitivity and thermal sensitivity. So if you feel that you've gone through something like that, that means you've bitten on something hard, or at the same time you have some grinding or bruxism kind of parafunctional habit due to which you feel that you have cracked one of your teeth, all you need to do is go to your dentist and they will see what needs to be done. So once you come to our practice, we will do some tests such as tooth sleuth test, at the same time transillumination test, and probably take a brief history about what has happened and how you're feeling about the tooth in question. So let me explain what a tooth sleuth test looks like. We will take something known as a tooth sleuth and we'll keep it between your teeth, the teeth in question, and we'll ask you to bite. If you feel that the pain is increasing upon biting, or at the same time it is increasing while you're releasing the bite, it's high likely that you have cracked tooth syndrome, because of the fact that the crack that is present, it will tend to open up because you are closing on to the teeth, and that will send a signal to your brain in the form of pain. At the same time, there is transillumination test where we have UV light that will be passed through the tooth and the cracked interface will be visible to us. We also have some sort of stains and dyes that we can use to apply on the tooth surface, and we can see the interface of the crack. Now, depending upon how deep the crack is, the treatment differs. Usually if the crack is just into dentin, we can do a direct restoration, which can be of cuspal coverage or non-cuspal coverage. That is the discretion of a dentist. Otherwise, if you feel that there is more of thermal sensitivity and thermal symptoms, and the crack has gone to the pulp, we might require endodontic treatment. If the crack is too big but not gone into the pulp and your symptoms are a little too much, we might also advise you full coverage crowns. However, if the crack has gone down to the root and it has created a vertical root fracture, then unfortunately my sympathy and empathy towards you, we might have to extract the tooth. So this was today's episode about cracked tooth syndrome. And if you ever feel something like this has happened with you, please visit your nearest dental office and tell them what has happened, and let them do their job and see and help you get rid of the pain. So this was today's episode. Please like, share and subscribe, and don't forget to press the bell icon for important updates. At the same time, if you want to contact me, these are my social media handles and my WhatsApp number for teleconsultation. However, I might not be able to answer your call directly because I might be busy with the patient or otherwise. So please like, share and subscribe. Have a nice day. Thank you.